A massive effort happening now to get COVID-19 vaccines distributed in Illinois and around the world. UNICEF is leading efforts in shipping, storing, and helping distribute the vaccines.
And joining us now is Michael Nienhuis, the president and CEO of UNICEF USA. Michael, thank you for being with us. Nice to have the person right at the top to get at the heart of this. When you think of UNICEF, a UN agency, you think of children. Can you tell us how your organization got tapped for this big effort and what it is you'll be doing?
Well, a couple things. Thank you first for having me and for your interest in the topic. UNICEF has, number one, the largest global humanitarian supply chain in the world to deliver products to the most vulnerable countries all over. And secondly, we vaccinate 45% of the world's children under 5 with their basic vaccines. So we know how to do vaccination programs. We have a terrific supply chain globally. And so that has been called in to help with this effort to get COVID vaccines to more than 80 of the low and moderate income countries around the world.
So how many people are you talking? And is it just children?
No, actually, we won't be vaccinating children. So this is different for us.
Oh, I see.
Children are clearly affected by the pandemic in so many other ways. But they're not the most at risk for the disease themselves, for the virus themselves. So we're using our global supply chain and our expertise in vaccinations to deliver the vaccines first for healthcare workers and other frontline workers, and then for people in high risk categories. And our goal is to have about 2 billion doses of vaccine delivered to those 80 plus countries by the end of 2021.
And talk to us a little bit about the connection that UNICEF has to the vaccines that are coming and continuing to come here to Illinois.
Well, we're part of a large global partnership called the COVAX facility, which is led by the Global Vaccine Alliance, Gavi, and the World Health Organization, and we're a critical partner of that as well. And this group is having conversations with all of the manufacturers around the globe that are moving forward with COVID vaccines. So we're in conversations with all of them and looking to source vaccines probably from many of them once they're approved to be able to meet the need, the global need for this in places that are just don't have the same access. We're really interested in equitable access to the vaccine. I like to say, that the health worker in Malawi needs the vaccine just as much as the health worker in Chicago does,
right?
Because they need to be safe in able to deal with the patients and the people in their communities.
So that will be some of the places like Malawi and some way out in the outskirts of the area that you'll be doing?
Yeah, exactly. Again, more than 80 of the low income and moderate income countries around the world. So you're talking about all the places where UNICEF works every day to work with vulnerable children, whether it's in places of crisis or endemic poverty or where there's other issues going on where it makes this kind of difficult. But again, this is what we do. UNICEF is made for this moment. We deliver vaccines and other vital supplies already to these kinds of places, and we can do it too with the COVID vaccine.
But Michael, I'm guessing that you've never had to do it under the conditions that this first batch of vaccine has to be super cold. How have you been able to address that obstacle?
Well, some of the pre-work we've been doing in many of these countries is inventorying refrigeration systems at hospitals and health centers to understand where we can deliver vaccines that need super cold storage and where the next crop of vaccines that are likely only to need basic refrigeration, where those can be used as well. So we're probably going to need all of that. But the first thing is to determine where can we deliver which vaccines when they're available. And our teams have been doing that along with training health workers already and getting the health systems in shape to be able to handle the vaccines when they come.
Michael Nienhuis with the effort there at UNICEF. Good luck. Thanks for doing what you're doing, and thanks for sharing the information with us tonight.
Thanks. We'd love for people to go to our website and find out what we're doing, unicefusa.org, and keep track of this really important effort to beat the pandemic globally, not just here.
Thank you, sir. Be safe. Be well.
Thanks. You too.